So let's talk a little bit about iovera and cryotherapy and cryoanalgesia. So it's the local or general use of low temperatures in medical therapy. The application of cold to nerve tissues blocks the conduction of pain signals to the brain. And this technically or officially known as cryoneurolysis. Cold has been around for a long time, right? And so when you're a child, you fell and you hurt yourself, and someone put an ice pack on your swollen wrist. What happened? The swelling went down and the pain went away, right? So this has been around, or this concept in terms of cold mitigating pain and reducing pain has been here for quite some time, and we've all experienced it ourselves. We've been using cold therapy or targeted cold therapy for a long time medically as well, right? And so liquid nitrogen has been used for some time, ablating tumors and so on and so forth. And usually these are these large units that live in the basement of the hospital. There's a harpoon and it's got a tube attached to the liquid nitrogen tank, and you go ahead and ablate whatever tissue you want. But the problem with that is it completely destroys the tissue. So fast forward, and we started realizing that nitrous oxide may actually be a way to deliver focused cold to a specific area and not necessarily create the deleterious effects that we saw with liquid nitrogen, which really froze the tissue at a much lower temperature than what we see with nitrous oxide. So really, nitrous oxide and its boiling temperature is the key to this whole thing, and that's what makes iovera and its impact really as special as it is. So the technology is immediate, it's safe, it's effective, it's non-systemic, it's a long-lasting nerve block. So it's basically a non-pharmaceutical long-term nerve block. And I want to highlight the point here that it's immediate. It's pretty impressive, and we'll talk a little bit about the immediacy of the treatment. We really don't have anything like that in medicine right now, short of the typical nerve blocks that we see anesthesia do in the perioperative period. So the two workhorse needles or smart tips that make iovera go, you see here, there's a trident needle, so three pronged 27 gauge needles, or this kind of longer 90 millimeter needle used to target deep nerves as well. So the short 27 gauge needles can be used with or without ultrasound. The long needle here typically is used with ultrasound. And basically what we're doing is we're essentially creating a tic-tac sized ice cube at the end of these needles. It's as simple as that. And the way the technology works is within that handheld device, we'll place a nitrous oxide canister. And the proprietary technology converts that liquid nitrous oxide into a gas. And this happens at minus 88 degrees Celsius. So I want you to take a minute here because this is an important concept. The boiling point of nitrous oxide is minus 88 degrees Celsius. So it cannot get any colder than this because this is the physical property of nitrous oxide. Okay, and that's important later on when we talk about the safety of this and how it impacts the anatomy and the physiology. And so what happens is with the iovera technology, it converts this liquid nitrous oxide into a gas. That gas then comes down and essentially chills these three 27 gauge needles. That gas then gets vented out through these needles and exits through the body of the handpiece. And so effectively what we're creating, like I said, is an ice ball at the end of these needles. That's it. So it's three 27 gauge needles creating a tic-tac size ice cube under the skin. And there's no drug, there's no chemical, there's no toxin. It's simply three little needles getting very cold. That's it. And so that's what the impact of this. It's fairly simple conceptually, but when we understand what it does to the anatomy, it gets to become a very powerful technology. And so this is what it looks like in an agarose gel. So imagine these two little green dots were two nerves under the skin. We're going to insert the iovera needles to the skin. You can see here there's this rectangular shaped thing here at the top of these needles. This is a warming plate. Extremely important that this warming plate touches the skin, because if it doesn't, then the cold will come up to the skin and potentially cause frostbite. So with the first generation of this way back when I started using it, this warming plate wasn't there, has since been added because obviously we learned that this minus 88 at the skin is not necessarily a good thing. And that's what allows the ice ball to stay at the tips of the needles. So we're going to insert the needles. Imagine the two nerves are sitting here. We're going to turn the device on. The ice ball is going to form, and then the nerves are slowly going to disappear. And then we're, depending on what technique you use, whether it's with ultrasound or not with ultrasound, you use anatomy survey, you'll then march along and target any remaining nerves that you want. This cycle to go from inserting the needle, having it become cold, and then warming up again is approximately 1 minute. So it's not very long for a complete cycle to go ahead and try to target the nerves that you're looking for.